Hello everyone, welcome to Dr. Chan's Minor Ailments Forum. And this week I would like to talk about a condition which is extremely common in our community, but not everybody knows about it. So the condition that I'm going to talk about is called atrial fibrillation, or the doctors like to shorten it up to call it AF. The simplest way to explain AF would be basically irregular heartbeat. But if you want to get down to the nitty-gritty of it, I've read it on a GP magazine recently, and basically the mechanism for AF is a loss of coordinated atrial electrical activities. So subsequently, it will cause a loss of atrial mechanical activity. Now, by understanding that, I think it's best to understand how a heart works. So before I get into the real anatomy of the heart, it's best to understand how common this condition is. So according to research, this is the most common sustained cardiac arrhythmia in the world. With the terms arrhythmia, it means irregular heartbeat of the heart. And actually, this surprised myself as well, because I was reading about atrial fibrillation on a GP magazine recently, and it says that about 10% of the people aged over 80 years old in the UK have atrial fibrillation. And I think it's a relatively high number, especially our community is actually aging. And to be honest, if you don't treat the atrial fibrillation, as in the irregular heartbeat, the complications are quite serious. And the most important one that I worry about is stroke. Because if the blood doesn't get pumped around the body in a regular kind of fashion, sometimes some blood clots will get stuck in the heart chambers and eventually may get shot out of the system and cause a stroke. So this is why I choose this topic to talk about, so we know what to look out for in the future. So let's get down to the basic of how a heart actually works. So most of us will know that the heart has 4 chambers. Okay, so the names are atria and ventricles. So we have 2 each. So the atria are located above the ventricles. So although the heart is not a square box, but you can imagine in the simplest term that the 2 atria boxes sit right above the ventricle boxes. Now, also inside the heart, there are 2 other structures that you need to know about. So one is called the SA node. The long name is sinoatrial node, and the other one is called the AV node, which is the atrioventricular node. So I see these 2 structures are the natural pacemaker for our heart. So let's talk about the SA node first. What it does is actually shooting out electrical signals at a regular interval. So you can imagine that when the SA node signal or shoot some electrical impulses, it will spread across the top 2 chambers, which are the atria. So this in turn will push the blood from the atria into the ventricle, and the heart valves help to maintain a single flow of the blood, so it won't pump back to the atria when the muscle relaxes. So when the impulse from the SA node gone to the AV node, you might think that it does the same thing, as in it causes another contraction of the ventricle immediately. Well, it doesn't work like that. It's actually working like a junction. So what happened is the AV node received the signal from the SA node. Then the impulse is delayed a little bit and then passed on to some thin fiber called the AV bundle, which eventually turn the impulse from the AV node to the ventricles. And these impulses will pass on the electrical signal to the ventricles and causing contraction. And this contraction of the ventricles would pump blood into the large arteries. And once again, the heart valves in our heart should stop the blood coming back. So the interesting thing is that you might think the ventricles pump blood to the same place, but actually they don't. The artery that connected to the right ventricle takes the blood to our lungs, and the artery that goes from the left ventricle takes blood to the rest of our body. So what happened in atrial fibrillation is your heart is not beating regularly because the signal that's sending from for example, the SA nodes or the AV nodes are not distributed in the normal fashions. So there's several causes of it. It could be a muscular problem of the heart, or it could be an electrical problem of the nodes. But either way, the potential symptoms would be you feel that your heart is beating faster than usual. You feel like you're running a marathon and you might have shortness of breath. And the heartbeat is irregular. So when you count it, it's not a regular boom, boom, boom. Like it's more like boom, 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 or even faster. You can also imagine that when the heart is not pumping in a regular fashion, then each time when the heart pumps, the intensity might change. So in that case, you can't guarantee that there's the same amount of blood is being pumped out from the heart each time. So sometimes the blood might get pumped a little bit, and somehow some blood might be sitting down in the chambers for too long and starting to clot and causing complications down the line like a stroke. So when the atria is fibrillating, it actually looks like a bit like a plate of jelly, and when you're shaking it, that's how it looks like. So it can be contracting very rapidly, and according to research, it can go up to about 400 times per minute. However, not all of these impulses or signal actually get passed through to the ventricle. So maybe half or even less than that of the impulses are actually passed through the ventricles to cause a contraction. So when people come into the surgeries and be seen, they don't actually come in and tell me, oh, I think I've got AF, because this is quite a technical diagnosis, I think. And most people would describe the symptoms that they have and make me think that they might have AF. So some people actually didn't notice that they've got it because they have no symptoms. And that's quite interesting sometimes. So it might be because it's not beating very fast. You can have a slow AF, which you might not feel that you're running a marathon, but most people will come in saying, I'm feeling that my heart is thumping, and in fact when it's thumping, it's not regular, and I also feel a bit sick at times, and I feel a little bit dizzy, especially when I'm trying to do a bit more than usual. In fact, some people might not complain of their heart beating irregularly. They might just say, oh, I've been feeling really breathless recently. I used to be able to walk up a mountain, no problem, and now I can't even walk down my road and I have to rest, and then I'm able to walk again. And some people might even complain of having chest pain when they're exercising. And in a serious case, they might just have chest pain when they're not doing anything. So these are the potential symptoms of atrial fibrillations that we should look out for. So you might ask, what are the potential causes of atrial fibrillation? Now, to me, the easiest way for me to remember, or for anyone to remember, is that anything that puts stress onto your heart can potentially cause atrial fibrillation. So the most common things would be people that might have had a heart attack recently, and then when they are treated and they realize that their heart rate is not regular, and also the people who's been having high blood pressure that's not very well controlled can have atrial fibrillation as well. Now, are there other conditions that might actually cause AF, and it's not directly related to heart playing up? For example, the most common one that we see in elderly would be they're normally fine and well, not actually on any medication, but suddenly they became unwell with a chest infection. And they've been to see you a few times, had antibiotics, not getting any better, and suddenly one day when they came in for review, you realize that apart from the pneumonia or chest infection, their heart rate is also irregular, and that contributes more to the shortness of breath. Now, interestingly, quite a lot of time in acute illnesses like that, if you actually treat the cause, as in to treat the chest infection and whatnot, the AF will go away. So that's also applied to, for example, people who's got overactive thyroid glands. That can cause your heart to go at a faster pace and have high blood pressure, so it potentially can cause AF. But if you treat the high thyroid problem, then the AF tends to go away as well. Now, we also recommend that people who are at risk of getting AF or actually have AF to cut down any caffeine intake, because caffeine, you can imagine that apart from it makes you feel more awake at time, but also causes increase of blood pressure and also can make your heart pump harder, so you can feel your heart pumping more. And in that case, it can actually cause atrial fibrillation as well if you drink a lot of caffeine. Now, so let's say we're encountering a patient who's got symptoms of potential AF. What do we do now? Well, number one thing is we need to check the pulse, okay? Not just to check the pulse at your wrist, but also, if possible, check it at the chest, because let's say if the heart is beating really, really fast, not all the pulses or the impulses from the heart will transfer into the wrist. So some occasion we actually notice that when we check the wrist, the heart rate is not very fast and it's more or less regular, but you actually listen to the chest, the heart rate from the heart itself is a lot faster than at the wrist. So that is number one thing that we need to do. And number two is to do an ECG. So it's an electrocardiogram. So you must have seen it on TV, watching medical show that a patient might have stickers on their chest and they're linked up to wires. And that actually read the electrical signal of your heart. Then that we can actually see is the heart beating regularly. Are there any changes that we should know? For example, maybe indication of a new heart attack or some changes that might cause the atrial fibrillation. Now, we should never forget to do some blood tests as well, because let's say if you check the full blood count, you might notice that the patient's actually anemic, and that anemia might cause heart failure, and heart failure is very likely to link with atrial fibrillation as well. Not always, but they've got some associations. And also it's important to check, for example, any sign of infection in the blood test, and also to look into the thyroid function, because as I mentioned earlier on, high thyroid can actually cause atrial fibrillation. And if we do confirm that someone has atrial fibrillation, we tend to refer the patient to cardiology for further tests, for example, echocardiogram, to look at the structure of the heart and to see if there's any reason why the heart is beating irregularly. So without getting into too much details about the actual treatment, we need to understand that the most important thing for a patient with AF is to be diagnosed quickly and have treatment, okay? So there are roughly two different kind of treatments. So there's rate control and also rhythm control. So rate control, as per the name, you can imagine that if someone who's got very fast heart rate, as in most of the cases, then you might want to control the heart rate with medications like a beta blocker or a calcium channel blocker, and these medications actually help to slow down your heart rate. And this rate control is particularly useful in patients who's got symptoms, especially those who said they have got shortness of breath or they've got chest pain, etc. I must say rate control is generally the more common way to treat AF when compared to rhythm control, because rhythm control is basically to turn the heart rhythm into regular, either by medications or to have electrical shock to the heart, which we call a DC cardioversion. But not everybody is suitable for this for these kind of management, as in rhythm control. And shocking the heart back into a regular rhythm, it would be only suitable for people, for example, if you have a really short span of AF, that's something that's really new, or if you are younger than 65, and if your heart structure is normal. So another thing that I need to mention is, let's say if you're diagnosed with atrial fibrillation and it's going to be an ongoing thing, as in your heart rhythm is not going to go back to regular, it's very important that you should be considered for anticoagulation, as in taking medication that to thin your blood to prevent blood clots that's forming within the heart chambers or within the heart to eventually cause stroke. As I think that the most important thing with AF is to control the heart rate and also stroke prevention. I must say AF is such a big topic and you can never fit everything into 15 minutes. But I hope that this introduction of atrial fibrillation is useful for you. And at least you know that if you feel that your heart is pumping in a funny way, or you feel that your heart rate is not regular, you know what to do is to go and see your doctor straight away to get investigation and treat it if necessary. Now, if you have further queries, please don't hesitate to contact your GPs, or you can drop me a line at my website, www.drphyllischan.com, and then we can have a further chat down the line. So until next time we meet, take care of yourself and have a very good week. Bye-bye.